This segment is sponsored by Women's Health and Healing Center.
Welcome back, everybody. I am with Mollie Maire right now at the Women's Health and Healing Center in Grand Island, and we are talking about the health of women when it comes to breast cancer and breast cancer survivors. So thank you for letting us be here this morning. Important topic.
Yes, very, very important topic.
Yes, and a lot to talk about. So
a lot to talk about.
Talk about first, let's start with your area expertise.
So my area of expertise is in breast cancer rehabilitation. We do both preoperative and postoperative services. So we have a wide range of things to offer for a breast cancer patient, from before surgery to all the way of fitting for your final bras, prostheses, anything that you'll need to get back to where you need to be.
So when we talk preoperative, what is exactly that when you're working with one of your patients that you're doing?
Yes, our preoperative services we like to offer to ensure that everyone is educated regarding what we do to reduce risk of certain postoperative complications, to get them fit with postoperative garments. So different bras and camisoles and different things they might need after they have a big surgery to remove a breast or a portion of a breast. And then we get them educated also on some exercises that they can do before they return to us to kind of keep things moving, keep limbs intact and everything going so that when they come back, hopefully we don't have to do too terrible much.
Right. Well, and I think that's important for women to have that reassurance to know that you're here to help them know afterwards, look, I'm here for you, and here's what you can expect, and here's how we're going to fit you for, a certain bra. Here's the exercises you need. Because a lot of times I think women they're thinking maybe no one's going to be there for me.
And I agree. There's doctors that provide treatment. There's the surgeons that do the actual surgeries to remove the cancerous tumors and things like that. But then afterwards, it's like, well, then what do I do? How do I get back to doing the things that I did before I had cancer? And that's where I like to step in. Provide support. Support is a big portion of what we do here.
Right.
I'm not a counselor by any means, but we always have an open ear to listen to complaints, concerns, and just I can always provide sources for support as well from past patients, or we have a support group here in town as well for breast cancer that is available to all breast cancer survivors, as well as just getting them back to doing the things they used to do through stretching, through exercises, through strengthening, through getting them fit with a bra and prosthesis so that they feel whole again, I guess a lot of women like to say.
Yeah.
So.
And how long does a recovery, and I know it's different for every patient, how long is that recovery time frame usually for a patient?
My plan of care typically spans anywhere from 6 to 12 weeks. It depends largely on what type of surgery you have. There's two different types of surgeries, a lumpectomy and a mastectomy, and one's a lot more invasive than the other, and it's going to typically require more rehabilitation. And then it also depends on what treatments you're given for your cancer. If you're doing chemotherapy or radiation therapy, those will add on sometimes possibly as well, depending on the things that those treatments bring about, the side effects.
So when women are doing their post-operative care, and you had mentioned there's stretching and things like that involved, what kind of exercises are involved for a woman to regain her strength?
Yes. So we do a lot of stretching kind of through the arm, through the armpit, and through the chest wall. As you can imagine, those are the areas that are going to be most tight after removal of a breast or a breast surgery. So we advance them through stretching exercises mostly to regain that range of motion in the arm if anything is lost. And then strengthening of the arm as well to help with chemotherapy side effects that can cause some weakness, as well as to regain that range of motion, regain that strength, and then some scapular strengthening, meaning we're going to work on pulling those shoulders back so we don't start getting that forward shoulder posture from that breast being removed and some muscle imbalance.
That's a natural thing then, that forward posture?
It can be after they do a lot of surgery and cut through a lot of muscles and different things, so we want to make sure that we keep our posture so we don't get that forward shoulder posture, and that's part of what we do here for some strengthening as well.
And you were talking too earlier about the lymph nodes and how important this is for your patients.
Yes.
To work through all of this, right?
Yes. I also am a certified lymphedema therapist, so we also educate all of our patients on lymphedema if they're going in for a breast cancer surgery.
Okay, I'm going to stop you right there because
know.
that sounded like a long word with a lot of questions. So we're going to take a quick break and come back and talk a little bit more about
Perfect,
that.
thank you.
So stay with us. We'll be right back.
When the
Welcome back. I'm here with Mollie Maire, and we are talking about how she helps and works with lymphedema patients. Did I say that correctly?
Yes, correct.
Yes, and we are here at Women's
Health and Healing
Health
Center.
and Healing Center in Grand Island. So when we're talking about lymphedema patients, explain that, first of all, for those of us who aren't familiar with what you're referring to.
Yes. So lymphedema is typically a damage to your lymphatic system, which is the system that removes fluid, excess fluid that's just naturally in your body, comes down in your blood, and has to be removed. And when part of that lymphatic system is removed with cancer surgeries or lymph node removals, or there's damage to that system for any reason, then there's a decreased ability for your ability to drain all that fluid out. So that fluid might start to accumulate in your limb, whether it be your arm, your leg, depending on where the lymph node has been removed from, lymph node or lymph nodes, it depends.
Is that painful to a patient when that swelling occurs, or is it just uncomfortable?
Probably more of a discomfort than necessarily pain. It depends on how severe that lymphedema gets. The more severe the lymphedema gets, the more you are prone to wounds and permanent skin changes and things that can be painful. But hopefully, these things are caught early, and you can get to me before we progress to that stage. We can get it resolved before it becomes something that becomes super painful or discomfort.
So how do you resolve that swelling in, your arms, your legs, or wherever it is? What's the process?
So we have a laundry list of things that we can do to help, which is a good thing. Depending on severity, we have manual lymphatic drainage massage that we complete, which is just a light skin stretch massage to the extremity, stimulate that lymphatic system, get it to help move some of that fluid, and we reroute it to a different set of lymph nodes, either in the lower extremities or in the upper extremities, to try to help those more intact lymph nodes take up that fluid and get it out of the limb that's swollen. And then once that is achieved, we can fit for compression garments. So I'm a certified fitter and measurer for lymphatic garments. And so I can get you fit with anything and get anything ordered that we need and make sure that you can get those off, get those on, know how to properly take care of them.
Which is very important.
Very important.
Is that something that a patient will have to wear the rest of their life then?
Typically, if you are a lymphedema patient, it is due to lymph node removal. And when those lymph nodes are removed, they do not regrow, they do not regenerate, they are just gone. So you will always have a lymphedema risk. The positive aspect of that is, even though you have a lymphedema risk, that doesn't mean you're going to develop lymphedema. And if we can get it pushed back into what we call a latent stage, or you're at risk, but you're not developing signs and symptoms of lymphedema, then hopefully we can hold you there with garments, exercises to complete at home. There's different things like pumps and all self-massage, all kinds of different things that we can do to educate that patient how to take care of this problem at home.
And this is usually, I'm assuming, and correct me if I'm wrong, is this post-surgery then when we're talking about this, something like this treatment?
Most typically, if we're talking about a cancer survivor, it's typically post-surgically when a lymph node has been removed from whichever area that cancer was found in. Removal of those lymph nodes will then increase your risk for developmental lymphedema. And to go back to some of the breast cancer stuff, I do full education on lymphedema risk reduction for those patients and any patient that is going to be undergoing a cancer treatment.
And you mentioned the massage part of it, massaging, I guess you're massaging the swollen part to get that water to move somewhere, that fluids to move somewhere else. How long of a treatment, and is that do you usually just do one treatment like massage, or are there several things put together?
Yep, it's kind of a comprehensive program that we do. So massage is probably the biggest component of that program. And people like the massage the best typically.
I bet they do. That sounds like it would be very, relaxing for your patients.
Yes. And it's not typically a masseuse massage.
Right.
But it's a medical type massage that is, I'm certified and trained in to help reroute that fluid to a different area. But then we also have different, like I said, garments, exercises that we can progress a patient through to help keep that fluid moving, number one, and then to help that limb stay down.
Perfect. Well, I have to say, Mollie, you're very passionate about what you do.
Thank you.
And your patients are lucky to have you.
Thank you very
being here
much.
doing what you do for them. So if they want to get in touch with you, where are you located here?
We are at 905 North Custer here in Grand Island, just a little ways east of the hospital here.
Okay.
And you can reach us also by phone at 308-390-1202. And we're available Monday through Friday.
Perfect. Well, get in touch with Mollie, and thank you again for your heart, what you do, and thank you for letting us come and talk
Yes,
with you.
thank you very much.
Appreciate it. And we'll be right back.
Ladies